So what is the compliance of the lungs? Compliance is nothing but basically it is the increase in volume in lungs when there is a unit increase in transpulmonary pressure. It is and the increase in transpulmonary pressure is generally in centimeter of H2O. Okay. Now there is a graph between pulmonary pressure and lung volume. We increase pulmonary pressure little by little and we see the increase in lung volume. The expiratory compliance curve, that means the relation between increase in pulmonary pressure and lung volume, that is expiratory compliance curve, and decrease in pulmonary pressure little by little and the relation with that with lung volume is inspiratory compliance curve. They are not similar. There is an area between them. The increase of pulmonary pressure is small and steady. Now compliance diagram, that means this diagram is affected by elastic properties of lung. Lungs elastic property comes from two things. First of all, lung tissue, and second of all is the surface tension. Actually there is alveoli is lined by fluid and this fluid comes in contact with the air of the alveoli. This air and fluid surface creates surface tension. Lung tissue, the elasticity of lung tissue is determined by mainly two tissues. These two tissues are collagen fiber and elastin fiber. By two fibers mainly, collagen fibers and elastin fiber. They are present between lung parenchyma or lung tissue. They remain kinked during expiration. When we expired, the volume of the lung gets shrinked and they remain kinked. But when we expire, they get stretched and their elastic property, their tendency to get back to that kink state increased, and they supplies the elasticity. And there is surface tension also. Now here is a graph. When a filled lung with some saline solution, and in that case there is no factor of surface tension because there is no air fluid surface is made. In that case, a little increase in pulmonary pressure causes a great increase in lung volume. But in general, a compliance diagram is like this. So without surface, in general we need 3 times more force to expand the lung than when in comparison when there is no surface tension, the factor of surface tension. So the contribution of the elasticity of lung tissue in elastic property of lung is just 1/3, and contribution of surface tension is 2/3. This contribution increases more when there is lack of surfactant in lungs.